In this lecture, we will discuss left arm, left leg lead reversal and how to identify it on the EKG. Making sure that the EKG leads are connected to the correct electrode position is important for getting accurate rhythm strips in 12-lead EKGs. If the leads are reversed, we call this lead reversal and can often produce EKG abnormalities. It is important to be aware of these accidental misplacement of the limb lead electrodes because they may mimic various pathology, including chamber enlargement and ectopic atrial rhythm, or even myocardial ischemia and infarction. Now, when the limb electrodes, that is the left arm, the right arm, and the left leg, are exchanged without disturbing the neutral electrode, which is the right leg, then Einthoven's triangle is flipped 180 degrees or rotated, resulting in leads that switch positions, become inverted, or remain unchanged, depending on their initial position and vector. Remember, the goal is to be able to see why these EKG changes occur and then be able to reason them out on your own instead of memorizing anything. We'll also mention a few things to look out for in this case. Here we'll be looking at what happens when the left arm and the left leg electrodes are reversed. In other words, there's a 180 degrees vertical rotation around the AVR axis, okay? So now the one that's not changing here is AVR. So AVR is what we're going to rotate everything around, okay? So imagine AVR here. We'll draw this here. And what we're going to now switch is the left arm and the left leg, okay? So left arm and left leg switching positions, okay? And they're rotating around this axis here as AVR. Now, because we're rotating around AVR as the focal point, we said that AVR will remain unchanged. With all the other limb leads, they will become inverted or switch places. In this case, lead 3 will become inverted, leads 1 and 2 will switch places, and so will leads AVL and AVF. Okay, so let's look at these. So again, the focal point here is AVR, so that's going to remain unchanged. So AVR is unchanged. Here's AVR. Notice that it is unchanged in this place here. Next, we said that lead 3 will become inverted. Okay, so here's lead 3 directed in this direction. Now, if you invert it, now it's going to be directed in the opposite direction. Okay, so lead 3, which is here, notice how it becomes negative in the limb lead reversal of this one, okay? So this is normal, remember, and this is our left arm, left leg reversal of the limb leads, okay? So now we've inverted lead 3. We said that lead 1 and 2 will switch places. Here's lead 1, here's lead 2, okay? And notice if we rotate around this, they're simply going to switch places. So now lead 2 is here and lead 1 is there, okay? So notice lead 2 is here and lead 1, and we're switching these positions, okay? So now lead 2 comes up here and lead 1 is there, okay? We also mentioned that AVL and AVF will switch places, okay? So here's AVL, here's AVF. Again, we're rotating around AVR as our focal point, and now AVF will come up here and AVL down in the AVF's prior position. Okay, so here's AVL, AVF, and these will be switching positions. So now AVF is going to be here, and this will be AVL, okay? So hopefully that makes sense. Remember, AVL was mostly negative here, and you can see that it's now become in this position down there. So if you see an inverted lead 3, including the P waves and or the QRS complexes, you should really consider this left arm, left leg lead reversal. Although it's important to be aware that physiologic left axis deviation can also cause negative QRS complexes in lead 3, okay, so make sure you're aware of that. Another thing is that that can point to this left arm, left leg reversal are P waves in lead 1 that are larger than P waves in lead 2. Usually it's the other way around, okay? So we're seeing that having larger P waves in lead 1 than compared to lead 2 can also point to this. So here's lead 1. These are the P waves here. Notice that normally lead 2 P waves is larger than that in lead 1, okay? Although with this reversal, notice now lead 1 has a larger P wave compared to that in lead 2. So that's something else that can point you towards this left arm, left leg lead reversal. All right, let's briefly review what we discussed before we end. So this left arm, left leg lead reversal is a 180 degrees vertical rotation around the AVR axis. AVR is here. We rotated everything around it. Okay, so draw out Einthoven's triangle, label it, use AVR as the 1, and you're switching the left arm and the left leg. Because of that, AVR will remain unchanged. Lead 3 will become inverted. Leads 1 and 2 will switch places, and so will leads AVL and AVF. And remember, another clue was that having a larger P wave in lead 1 compared to lead 2 can also point you towards this, because usually it's the other way around. Well, that's the end of this lecture. We discussed left arm, left leg lead reversal, and how to identify it on the EKG. I hope you learned something.